Dr. Leila, can you please tell us about yourself?
Yeah, welcome in my clinic. My name is Leila Soudah, as you said. I am originally Palestinian. I went to school in Jordan, as most of the Palestinians. I lived outside Palestine. Finished my school, 13th class, and then I went to Germany to study medicine. I went with the idea to study medicine, and what I did, I went to medical school, finished medicine, and I had post-graduation in obstetrics and gynecology. I chose really this subject or this field because I thought, or I still think, that our women need a lot of support. And after that, I had my own clinic in Dubai. In Germany first, and then I opened my own clinic in Dubai. I am here now since almost 14 years.
So how did you get involved with anti-aging medicine, and why did you choose AFORM as your academic partner?
It was funny, actually. By chance, I had an invitation from the compound pharmacy for a lecture that was in November 2 years back. But with my background studying in Germany, Germany has a lot of alternative medicine. They do a lot of homeopathy, alternative medicine, organic food, exercise. So I had already foundation of being preventive, right? To prevent sickness, prevent problems, not jumping into medication, into antibiotic. So as I went to the Congress, or it was a lecture for one whole day, I was very much impressed from the ladies, from the doctors who make the lecture. And that day really changed my life. And from that moment, I decided to be a member and start studying on a regular basis.
Brilliant.
Yeah.
Can you please tell us how you think anti-aging medicine will evolve as a mainstream type of medicine, especially in the Middle East?
I think we might face problems here because the main problem, in my opinion, in the Middle East, that patients or people in general can go to counter and get almost any medicine they want, including antibiotic, contraceptive, hormones, without any prescription. Here is the main problem, because patients go to the pharmacy and get whatever they want. So a lot of times they don't need to go to the doctor and ask even for opinion. This is one of the major problems. The second issue is people are not informed enough. People, they think, okay, the last time I went to the doctor, he gave me 1, 2, 3. So I go to the pharmacy, I get 1, 2, 3 again and again and again, and I will go to the doctor when it's really worse. So we are facing problem of education, of awareness, though I think that we have a good chance, because in the Islam we say al-wiqaya afdalu min alfi ilaj. That means to prevent yourself getting pregnant, getting sick is much 1,000 times better than take medicine. So I did not translate it now word by word, but in general, that preventive medicines, even in the religion. The religion say to us, take care of yourself, prevent being sick, eat healthy, do exercise, and then see how life. So I do believe we should focus that the patients start thinking about their health and the doctors start listening what's the complaint of the patient. Because usually if you go to, for example, if a patient comes to me with abdominal pain, I cannot tell her I am a gynae doctor if the pain is around the stomach is not my field, because this could be related to other sickness that she has. So I started looking at the person in total, which is very important. So we have to work on a doctor's level, on a ministry level, and on civilization, normal people. Approach them, ask them how they feel, write down what they feel, what they want from the doctor. When they go, they have to have a clear idea, what do I want from my doctor?
What is the highlight of A4M conferences in your opinion?
They are extremely organized. They are extremely detailed in their lectures, and they are all medical study based. That means they are not telling me, okay, for example, don't give nystatin to the patient with high cholesterol. They show me studies with based evidence studies done in even Germany, in Japan, in America, and they tell you, okay, why you don't do that? And they will give you alternative way. And this is what Every time I go to a lecture from American Anti-Aging, I come to the clinic and I know, wow, I know new things today, and I can immediately put it in practice.
Very nice. Please, can you say the 3 protocols or facts that anti-aging medicine has taught you and which have made a difference to your day-to-day practice?
Anti-aging changed my life, honestly. It's not just my life, it's changed the life of my family, my mother, my brothers. I could help my family, especially my mom, who is turning now 80, and change her life. In terms of my patients, I have the feeling I opened my eyes and start really listening what the patient is telling me. I have headache, I don't feel well, I cannot sleep. I was maybe 4 or 5 years before I was telling her, I'm sorry, but I'm not an internal doctor, so maybe you should see your internal doctor. Though I was always a kind of doctor who look at the person in general, but now I really listen much better. And I see that patient, I get a lot of testimony from a patient, they tell me, Dr. Leila, you changed my life. Dr. Leila, you give me my life back. So for me, anti-aging medicine is the future. It's simply the future, because I can see also the progress, what my patient is doing. It is not like I'm fanatic now because it's something new, not at all. If you do some practice and you see that the patient is really having profit of that, patient come one day crying because her hormone is imbalanced, and the other day she said, Leila, I start living now. By the way, my patient calling me Leila most of the time, okay. So I allow it. Yeah, I allow it. So
what would you say to those practitioners who are skeptical about the validity anti-aging medicine and about the need to get trained and certified in this field?
In my opinion, just be open. Just be open, just listen. I mean, it is hard. I had days where I said, oh my God, I studied 20 years and I'm still studying. That means I'm studying now since more than 30 years. Is this all wrong, what I studied? It is not really wrong. Now, because I studied 30 years, I am now in the situation where I can choose. Right? So I can know now, just open your eyes, listen, choose what is the best for your patient, and be open. I mean, anti-aging medicine is not telling me hocus pocus, sorry to say that. They give me study-based, evidence-based treatment, evidence-based theory, so just listen to them and open your eyes. Because I think with the normal medicine, with the commercial medicine, right? We know that the FDA keep promoting for things for years, and then we discover, oh, oopsie, sorry, we cannot do it, so we have to remove it out of the market, right? Yeah. So if every doctor will start just with 1 or 2 patients who are willing, the patient is coming and tell you, I don't want medication anymore. Just give me things to keep me healthy. So if the doctor just listen to the patient and open up their minds, I think then we will have all a better future. I don't say that commercial medicine is bad. Please don't understand, because we still, when we have cancer, we have to operate in cancer. When we have problem, we have to go with the normal medicine, what we studied. But be critical. Don't take everything that they told you for granted and close your eyes and write prescription for 10 patients the same prescription. You cannot do that anymore.
That's brilliant. Thank you very much for your time, Dr. Leila.
You're welcome. You're welcome. Thank you.